Hey guys, do a corrective exercise routine for your hip complex, for hip dysfunction. Mostly when you're doing a squat and you tend to have your hips fall forward. This is a great routine you can go through in your warm-up or your cool-down, or as a separate session on a training day, or on a off day where you want a lighter session. You can do this for that. So we're going to start with foam rolling, then doing stretching, then activating the underactive muscles, then integrating it into a functional movement. And so the first one is going to be foam rolling. You're going to do your calf, your TFL, or your hip, front of your hip, and your lats. So first is going to be calf. Do both sides. Remember, you're always looking for a knot, going slowly when you survey. When you find that knot, you can put the other leg on top, lift your hips for more pressure. Hold that for 30 seconds. If you're surveying, there's no knots that you can find, then you can just survey, kind of activate that tissue for about 30 seconds. Then we're going to do your front of your hip. We're targeting this area right here. So again, survey, find a knot, hold it on there for 30 seconds. If it's on an off day, you can do this, hold it for 60 seconds if you want. You're just looking for that tension to decrease in its pain level. You also want to take nice and deep breaths when you're holding it so that your body physiologically knows that it can live there. The last area for foam rolling is your lats. Bring the front leg, top leg in front, and then you're going along the outer border of your shoulder blade and right into your armpit. Do both sides. Then you're going to stretch. You can grab a dumbbell or even a shoe or a broomstick or a power strip. Make sure your ankle's straight. Bring that other foot in front. And you're already into a nice, good calf stretch. Hold that for 30 seconds. Do that on both sides. Then you're going to go to your hip. Okay, so your front knee is going to be in line with this hip. Okay, this down knee is in line with this hip. Okay, then you're going to rotate your foot towards the midline. See my back foot? Turn it in so that your thigh is externally rotated, actually. Then you're going to squeeze the glute on the side of the knee that's down. You squeeze that glute. Draw your stomach up. Stand really tall. Hold that for 30 seconds. So you do both sides. Then you're going to your lats. I like to use a chair or a couch. What you're going to do is position your elbows on the edge. Bring your palms together. Move your body back in such a way that you can fit your head down. Now what you're going to do is bring your hands to the back of your neck. Pull your stomach up. And then drop your chest down, letting gravity do the work while engaging your abs and not letting hyperextension happen through your lumbar spine. So you want to hold that for 30 seconds. Then we go to the activation. So the first one is a supine reverse plank. You're going to lay here, go this way. And what you're going to do is lift your hips up. Okay, pressing your shoulder blades down, lifting your chest. Hold for 2. Bring the hips down slowly. As soon as they touch the floor, you raise them up. Hold for 2. 4 seconds on the way down. Up. Hold 2. 1, 2, 3, 4. You're not resting your body at all. You're getting the whole push through your chain working on that one. The other one you can do instead of that, or in addition if you have time, is a side plank, bottom knee, bent knee, side plank with a leg lift if you're strong enough. Okay, so what I want you to do is position yourself in a partial squat position, but pulling the chest up and your shoulders back. Then what I'm going to do is you're going to drive your knees forward, almost like you're standing up from a squat position, and hold for 2. Move the hips forward, but you're locking your back in place, so you're getting the mechanics of a squat movement as you do this side plank with bent knee. So the hips bend, but your back stays locked in. Shoulders back, back straight. Slowly down, touch, come up, hold for 2 seconds. At the tops, do both sides. Last one is a single leg squat touchdown. So what I want you to do is the foot that you're on is absolutely straight. The other foot is also, we want to practice the mechanics correctly. So we want this foot not turned out, but straight as well. Then the opposite hand is going to come down and squat, bending your knee and your hip to touch the foot. Then you come up, squeeze the glutes. It's a 4 seconds on the way down. 3, 4, hold, 2, up. Own the position. 2, 3, 4, hold, 2, up. Lock the glutes at the top. So you're going to do 15 per side on the single leg squat touchdown. You're going to do 15 per side with the supine reverse plank or the bottom knee side plank. Okay? So that's your corrective exercise for hip dysfunction. Hopefully that'll help correct some of the squat mechanics problems that we see in people.